people from Dr. John Campbell's station and anybody else who comes across this video. The medical system was hijacked over a century ago by the Rockefellers. You know, I call these people the medical mafia, is what I call them, because that's what we're dealing with. They run the show. And it's been this way for decades. Decades. If you go against them, there are repercussions. Okay? And the medical system is a money-making machine. I know. I've been right in the middle of it. I know. I see the waste. Do you know how much medicine I have seen just wasted? How much money, Medicare money wasted? I mean, it's astounding. It is astounding. So, years ago, you know, these people hijacked the medical system. We used to use, you know, herbs and spices and flowers and roots, you know, to help with our ailments. And don't get me wrong, I am a nurse, and so I do believe that medicine has its place. But I also believe in promoting a healthy lifestyle. That's why I got into nursing. I mean, that's why I'm the gardening nurse. It's like, and, you know, when you get out in the real world, you realize that it's not what you were taught in school. You know, like, it's very disappointing, the food that is served in our facilities. I'm going to tell you, I seen for dinner one night macaroni and cheese and mushed vegetables. That was dinner. Like, it was this is dinner. And I'm like, are you kidding me? I'm like, is this even legal? Like, where's the meat? You know? So, on questioning this, because that's what a decent nurse would do, cheese is considered a protein. So that's how they got away with serving that crap, you know, for dinner. Instead of, you never see well-balanced greens, vegetables, meats, fruits. I mean, it's just, you know, it's not what we were taught. How do you expect people to be healthy when our bodies don't get the nutrition that we need? Okay? I mean, then what they do is they make Ensure, the same companies, the same people make Ensure with all these vitamins and all these preservatives and shit that ain't good for us in them. Fortified, I mean, while they make billions of dollars off of it. Doctors in our healthcare system make money off of your chemotherapy. They get paid to give you the drug. And I think it's actually the only drug legal to do that with in the United States anymore, because they really cracked down on some of that stuff. As a nurse, witnessing what they did during Roro and IVM, amongst other medications, is absolutely criminal. Absolutely criminal. They think that you're stupid and that you can't read a scientific study for yourself, you know, or data. It's not hard. I mean, an average human being can read and comprehend. And it's like, these people will tell you not to believe what you see with your own eyes. But the same thing that went on with this drug during this epidemic is the same thing under the same doctor, Dr. Evil is what I call him, with the HIV epidemic and the antibiotic Bactrim. Bactrim was proven, much like IVM was, to treat, in this situation, a type of pneumonia that AIDS patients get, not only treat but prevent. And this same doctor refused to let these people get adequate medical treatment. And it is astounding to me. Just even with what's recently went on. I mean, it's part of the reason I left out there, because it was like, because I can't go along with it. Okay? I cannot be complicit in homicide. Okay?